Hi, I'm Sarisha Lohano, and in the summer of 2021, I was an undergraduate research and education intern at the Hudson Cancer Research Laboratory. So, due to the COVID-19 pandemic, interns like me were unable to go in person into the lab, but our mentors were able to adapt the program to fit the circumstances. So, throughout the summer program, each of us aimed to answer one of the National Cancer Institute's 9 provocative questions by creating professional research proposals. I answered question number 1, which was, what are the underlying causes of the unexplained rising incidence in certain early onset cancers? And I did this by creating a proposal that specifically focused on how obesity alters metabolism and impairs immune function, contributing to the initiation of early onset colorectal cancer. In recent decades, diets that lead to obesity have been becoming increasingly popular. An example of this is a Western diet. A Western diet consists of high intakes of processed foods, red meats, fried foods, foods that are high in fat, and foods that are high in sugar. And from 2017 to 2018, the United States obesity prevalence was 42.4%, according to the CDC. So my proposal will be testing how obesity alters metabolism and impairs immune function, leading to an increased risk of early onset colorectal cancer. So early onset colorectal cancer is when a patient is diagnosed with colorectal cancer, but before the age of 50 years. So according to the National Cancer Institute and the Dana-Farber Cancer Institute, early onset colorectal cancer cases have increased by 51% since 1994. This is why the American Cancer Society and the U.S. Preventative Services Task Force have revised their colorectal cancer screening guidelines to begin at the age of 45 instead of 50. Hopefully, this will help prevent some early onset colorectal cancer cases and diagnose many cases early. This will also be really helpful because in the United States, 11% of colon cancer cases and 18% of rectal cancer cases have been occurring in people under the age of 50 years. And projections show that by the year 2030, colorectal cancer incidence will double and rectal cancer incidence will quadruple in people of this age group. Obesity alters metabolism in many ways. The first is by causing metabolic syndrome. Metabolic syndrome is when a person is diagnosed with 3 of the following factors: high levels of triglyceride, low levels of HDL cholesterol, which is the good cholesterol, high blood pressure, high blood glucose, and an abnormally large waist circumference. One of the underlying causes for metabolic syndrome has been shown to be obesity, according to the American Heart Association. And one could reduce their risk for metabolic syndrome by losing weight and eating a healthy diet that consists of whole grains, fruits, vegetables, and fish. A second way that obesity alters metabolism is with adipose tissue mass. So adipose tissue is an endocrine organ which produces adipokines, such as leptin, adiponectin, visifatin, resistin, apelin, and many others to help regulate the body's metabolism. So the way it works is that obesity leads to increased adipose tissue mass, which leads to an increased production of adipokines, which leads to a significant impact on the metabolism. This is because adipokines regulate metabolism, but high concentrations of it alter metabolism by interacting with long-term energy modulators such as insulin. Obesity is the state of a low-grade chronic inflammation in addition to abnormal levels of circulating nutrients and hormones. These abnormal levels of nutrients and hormones increase people's risk for nosocomial infections because their immune function is weakened. And recently, studies have found obesity to be a risk factor for increased morbidity and mortality. So, when a person's immune system is functioning properly, inflammation occurs to the infected or injured area, and it becomes swollen due to an increase in blood flow. And this is caused by macrophages, which are white blood cells, and cytokines, which are secreted by macrophages, working to fight off the infection. So the human body has a second type of cell that secretes cytokines, and these are called adipocytes, which are fat cells. And fat has recently been found to be an active endocrine organ, which means that it secretes many proteins and chemicals, including cytokines. So the way it works is when a person gains weight and becomes obese, their body begins to gain lots of adipose tissue mass, and cytokines are released from that, which causes inflammation of the body. And this causes the immune system to always be functioning, and this causes the person's immune function to be compromised. So my proposal consists of a 15-year study including 120,000 participants who are all current residents of the United States and have lived in the United States for at least 5 years. All of the participants will be between the ages of 25 and 45 at the beginning of the study, so that at the end of the 15 years they will be between the ages of 40 and 60. This would allow for data of all incidence colorectal cancer rates. In the study, the participants will be split up into 6 ethnic groups, each of which consisting of 20,000 people. The 6 ethnic groups are Hispanic, African American, Caucasian, Asian, American Indian, and Pacific Islander. The reason for these 6 are because these are the top 6 that I found to most populate the US. These constraints help consider factors such as ethnicity and location that could impact the data. So, the participants in each of the 6 ethnic groups are categorized into 5 subgroups based on their BMI at the beginning of the study. There will be 4,000 participants in each subgroup, BMI categories, from each ethnic group, and this will total to 24,000 participants per BMI category. The BMI categories are morbidly obese, obese, overweight, healthy, and underweight. Once a year as a part of the study, the participants will come into the lab for a follow-up and get their weight recorded, their BMI calculated, get their blood drawn, take a calorimetry test, be tested for metabolic syndrome, get their blood pressure taken, and be screened for colorectal cancer. So calculating each participant's BMI will help take data on how losing weight versus gaining weight over time affects early onset colorectal cancer rates. A BMP will be done to test how each person's metabolism is affected. A BMP is a blood metabolic panel, which is a group of 8 lab tests that measures many of the substances in the blood, such as glucose, calcium, sodium, potassium, carbon dioxide, chloride, blood urea nitrogen, and creatine. The calorimetry test will measure each participant's resting metabolic rate, and all of the participants will also be tested for metabolic syndrome to determine if their metabolism is impaired. All of these methods will be done to ensure that there is little room for error. An immunoglobulins blood test will also be ordered. This determines the level of immunoglobulin in the participant's blood. It's an immune function test. Immunoglobulins are antibodies that are infection-fighting proteins which are a main part of immune function. They help fight off things such as viruses and bacteria. If there is an abnormal amount of immunoglobulin in the blood, the measurements from the blood test will help analyze how the immune function has been impacted. Screening all of the participants for colorectal cancer helps keep a running tally of all incidence colorectal cancer rates in the study. This information will be helpful during the data analysis. As a part of the follow-ups, all of the participants will also fill out a questionnaire about their diet over the past year. This will help determine the effects that diet has on BMI and results. The questionnaire that they will fill out is the NCI, the National Cancer Institute's, Diet History Questionnaire 3. This questionnaire is free to use with adults 19 or more years of age, and this version can be used by researchers, clinicians, or educators to assess food and dietary supplement intakes. It consists of 135 food and beverage line items and 26 dietary supplement questions. Some of the food and beverage questions have additional questions added on in order to allow for more accuracy. This method complies with ethical research methods because all of the participants will sign a consent form at the beginning of the study, allowing me to perform all of these tests and analyze the data as well as release all of the results from the study. I'm not harming anyone, and if any of the participants decide at any time that they no longer feel comfortable sharing the information mentioned earlier or just don't want to be a part of the study anymore, they can leave at any time, and if anyone chooses to leave during the study, their past results and analysis will be omitted and discarded. I anticipate that the more similar a participant's diet is to a Western diet, the higher their weight and BMI will be. I also anticipate that an African American participant who has a diet that closely resembles a Western diet has higher chances of having a high BMI or weight than an Asian participant who has a diet that closely resembles a Western diet. The reason for this is because the CDC says that obesity affects some ethnicity groups more than others, and their statistics show that non-Hispanic Black adults, which are African Americans in this study, have the highest age-adjusted prevalence of obesity with 49.6%, followed by Hispanic adults with 44.8%, then non-Hispanic white adults, which are Caucasians in this study, with 42.4%, and finally, non-Hispanic Asian adults with 17.4%. The CDC's website does not include the statistics for the American Indian and Pacific Islander ethnicity groups, which are the other two ethnicities in this study, so I do not have an anticipation for that. I do expect a higher weight in BMI to result in a lower resting metabolic rate and metabolic syndrome, and this is because people with a higher weight would have higher adipose tissue mass, meaning increased levels of adipokines would be secreted from the adipose tissue, and this would cause their metabolism to be altered because of the adipokines interacting with the long-term energy modulators. I also anticipate a higher weight in BMI to result in an abnormal amount of immunoglobulins in the blood, thus impairing immune function. This is because obesity causes an inflammation of the body, thus using the immune function system constantly. This compromises the immune system by preventing it from being able to fight off infections fully. I expect all of this to lead to a higher risk for early onset colorectal cancer. And the results of this study will help us understand how our diet and weight affects our risk for early onset colorectal cancer and how we can alter our diet and change our weight to lower our risk. So, after looking at the diet questionnaires, the lab tests, and the colorectal cancer screening results from the follow-ups in this study, most likely it should be shown that obesity slows down metabolism and impairs immune function, causing a rise in early onset colorectal cancer cases. This would mean that there's an increased rate for early onset colorectal cancer in patients with obesity. This provocative question questioned the underlying causes of the unexplained rising incidence in certain early onset cancers. So from this study, obesity can be proven to be one of those underlying causes. So obesity is becoming very common in the people of the United States, and this study shows that diet is a big factor contributing to this. This study shows that if we adjust our diets to be healthier and make sure that we are in the healthy BMI category, we could minimize our risk for early onset colorectal cancer. Following this would also ensure a regulated metabolism and a well-functioning immune system. Some future areas of research could include a wider variety of ethnicities and could focus on different areas of the world than just the United States. Similar studies could also be done for a longer period of time to analyze long-term impacts and risk rate changes. Some future studies could also be done to focus on how being in the underweight category affects risk for early onset colorectal cancer. Some more studies could also be done to look at the relationship between heart disease and early onset colorectal cancer risk, because both conditions have similar underlying causes. I would like to thank the Hudson Cancer Research Laboratory staff for making this possible. I would also like to give a special thanks to Dr. Carter, Dr. Douglas, Dr. Snyder, and Professor Fritz for doing an amazing job of putting together this program, from which I have learned a lot and thoroughly enjoyed.